extra-pulmonary or outside lung NECs for a substantial number of patients who are in need of therapeutic advances. However, there is a ray of hope. Hello, everybody. Today we will be discussing a very unique subset of neuroendocrine oncology called high-grade, poorly differentiated neuroendocrine carcinomas. And I have a very esteemed colleague who have spent a significant amount of time advocating for neuroendocrine carcinoma patients, Ms. Susan Plummer.
Hi. So I've been working with neuroendocrine carcinoma patients since 2013.
Let's first understand what high-grade neuroendocrine cancers are. So when I see a patient who has been diagnosed with neuroendocrine tumor or neuroendocrine carcinoma, I first like to orient the patient that this is not a single disease. It's rather a spectrum of diseases. The first dichotomy or the most important differentiation in different types of neuroendocrine cancer is based on morphology or how these cancer cells look under the microscope. There are primarily two types of neuroendocrine cancers. One is called neuroendocrine tumor. They are relatively slow growing as compared to neuroendocrine carcinomas or NECs, very fast growing, very fast paced disease. So a very different disease altogether. Different prognosis, different outcome, different type of scans, different diagnostics, different therapeutics. These are very aggressive and very fast-paced type of cancer, so you have this sense of urgency.
That is, and the one word that we use often, the word urgency. Many patients are told at the very beginning that they have neuroendocrine cancer. They're not told the difference between an NET and an NEC. And it's honestly because a lot of oncologists, community oncologists, really aren't familiar with the difference and the aggressiveness of this. And I think that when people get this diagnosis, they go into a panic. They're not getting the help they need. And this is part of the issue of why I do what I do, because this group of patients needs help today and yesterday, and we can get them the help that they need and calm that panic and calm those emotions, because there is help. Today there is help.
All right, let's switch gears and talk a little bit about treatments. Now, as I alluded to earlier, EP-NECs or extrapulmonary neuroendocrine carcinomas oftentimes are treated akin to small cell lung cancer. However, because of the paucity of treatment options, we still sort of rely on our small cell lung cancer regimen. And we've been using a regimen called platinum doublet since 1980s, carboplatin etoposide, cisplatin etoposide. And for many patients, it does work very well. Unfortunately, the effect is short-lived. Another issue, as you alluded to, is the urgency of the matter. A lot of times for NEC patients, we get them admitted and get them started on chemotherapy right away.
Whether it's platinum or Folfox, or now we have so many new options.
I think we've made a lot of progress in terms of treatments we could offer 7 years back versus now. But in my world, where I focus on EP-NECs, I'm very excited about Obrextimec. It is still under investigation, and we're going to yet to see how it all pans out. But at least there is hope and optimism. Previously, as you mentioned, there were just no drugs under development.
You mentioned hope. Today there is hope.
Yeah, a lot of progress and still a long way to go. So let's summarize this wonderful conversation and podcast focusing on ECs for our audience. Unlike neuroendocrine tumors, EP-NECs, extrapulmonary neuroendocrine carcinomas, are poorly differentiated, are high grade, are very aggressive, fast growing cancers, and unfortunately have poor prognosis. However, there are a lot of very promising treatments in the pipeline right now, especially DLL3 targeted T cell engager therapies like Obrextimab and several others in development right now offer a lot of hope to our patients who are in dire need for improvements in the therapies. Access to a patient support group like the one Susan has and several others are focusing on high-grade neuroendocrine carcinomas, very crucial to help patients and caregivers navigate this very treacherous journey. Thank you so much for listening in and tuning in.
Thank you, Aman.